Welcome to the second section of Hazardous Drugs and Your Safety, balancing cutting-edge medicine and team welfare. In the next 10 minutes, you'll learn about your risks of exposure to hazardous drugs. You'll also learn what factors impact these risks and whether there are real risks for you and your team. Has anyone ever told you not to worry about the drugs you're handling? Hazardous drugs do have potential risks. The adverse effects of exposure to hazardous drugs are similar to those in patients being actively treated for cancer. Not all drugs have the same risk. You need to consider a drug's toxicity. This refers to the type of harm a drug can cause to a person's health. Cytotoxic drugs are used to kill cancer cells, but they can also cause cancer or other harm to healthcare workers who work with or handle them without adequate protection. Do you have people on your staff intending to start a family? Some drugs may harm a person's ability to have healthy children. You also need to consider a drug's potency. Some drugs are very toxic at very low doses, while other drugs may cause harm only when a worker is exposed to very high doses. You can be relieved to know that exposure to high doses of hazardous drugs is uncommon in most healthcare settings. Of course, you still need to be informed and protected. Are you wondering how you can easily check the drugs that you're working with? Find your safety data sheets. Each hazardous drug has one, and it will give you a wealth of information. You will find the risks associated with handling this drug. You will also find recommendations for personal protective equipment and proper safe handling to reduce your risk. Have you considered the various routes of exposure beyond the obvious needle poke? There are many different routes of exposure, both for human healthcare workers and for veterinary team members. Everything from receiving hazardous drugs to cleaning, transport within the hospital, storing, compounding, dispensing, administering, patient care, spills, disposal, and managing waste have points that can expose you to hazardous drugs. Why are there so many routes of exposure? Our bodies have a few weak points of entry. The three basics of exposure are inhalation, dermal, and ingestion. You can be exposed to hazardous drugs by breathing vapors, dusts, or aerosols, absorbing them through your skin contact by touching dust or liquid residue on surfaces, swallowing them with contaminated food or gum, or accidental injection. Does your pen ever go in your mouth? This can be a route of exposure if you have residue of a hazardous drug on your hand when you touch the pen, or if the pen is left on a surface that has residue of a hazardous drug. Your skin barrier may not be perfect, and you might even not know. Drugs may be absorbed through the skin, particularly if your skin is chapped, abraded, or has cuts or scrapes, or if you bite your nails. Skin may be traumatized, or there may be drug residue that's ingested when you're biting your nails. It's very important for you to know all the basics about the drugs you're handling. The physical and chemical properties of drugs that influence their hazard include vapor pressure, physical state, solid, liquid, or gas, and molecular weight. Drugs in liquid or powder form may be inhaled as aerosols, droplets, or dusts. Again, refer to your material safety sheets for safety information. Is it a pre-filled syringe, or do you need to mix it? The drug formulation, whether it's powder, liquid, capsule, or pre-filled syringe, is important. Like a drug's physical and chemical properties, the formulation of the drug is an important indicator of the types of precautions needed to avoid exposure. Different risk management strategies are needed for powders than pre-filled syringes. Who is at risk? Clinical healthcare workers who may be directly or indirectly exposed to hazardous drugs include nurses, pharmacists and pharmacy technicians, physicians and physician assistants, veterinarians and veterinary technicians, and operating room personnel. Could this include you? Let's talk about real-life terms where you could be exposed to a hazardous drug. In the counting, crushing, or breaking of powdered tablets, mixing cytotoxic drugs into intravenous fluids, preparing or administering cytotoxic drugs, handling any material that has been in contact with cytotoxic drugs, such as needles, syringes, IV bags, tubing, incontinence products, soiled linens, used personal protective equipment, drug packaging, and waste. Cleaning areas where cytotoxic drugs are used. What if you're not a veterinarian or a veterinary technician? Are you still at risk of being exposed to hazardous drugs? All workplace activity needs to be considered. Do you receive the pharmacy deliveries? Are you responsible for spill cleanup? Do you walk and feed animals on chemotherapy? Where do those patients defecate and urinate? Do you clean up vomit or diarrhea in the hospital? Do you empty hospital waste? Do you do hospital laundry? Do you clean the hospital? These are all instances where you could potentially be exposed to a hazardous drug. Is this just theoretical, or is there actually proof about the risk of exposure? What does the science tell us? A study compiled data from 20 different studies published between 1992 and 2011. Here are some of the most important results they found for healthcare workers who handle chemotherapeutic hazardous drugs. Biomarkers of exposure were found in the urine of healthcare workers in 17 of the studies. Measurable levels of chemotherapy drugs or the byproducts were found in urine samples of healthcare workers, indicating substantial unintended exposure and uptake of chemotherapy agents despite protective measures. Some of the studies reported measurable urinary levels of chemotherapy drugs in as many as 40 to 100% of the healthcare workers. So those studies were in the human medicine field. Do the same concerns apply to people working in veterinary medicine? Let's look at the veterinary team exposure stats. The risk of exposure for veterinary healthcare workers is similar to that for human healthcare settings. In the United States, an estimated 500,000 veterinary healthcare workers are potentially exposed to hazardous drugs or drug waste at their work sites. Many are women of reproductive age. These workers include veterinarians, technicians, kennel workers, cleaning and maintenance workers, and office staff. Skin absorption, inhalation, and ingestion are the most likely ways these workers may be exposed. Needle stick or sharps injuries also pose a risk of exposure in veterinary healthcare settings. Administration of medications to animals presents additional exposure opportunities for workers that are not encountered in human medicine. What about specific Canadian veterinary exposure risks? For chemotherapeutic agents, exposure was predicted in up to 5,300 or 23% of all veterinary workers, with an estimated prevalence range of 22 to 24% of veterinarians and 20 to 21% of veterinary technicians. Have you ever wondered if you should be wearing personal protection equipment during a procedure? Consider this quote: "Veterinary professionals have higher exposure to chemotherapy drugs than their counterparts in human medicine because they are not taking proper precautions," say the researchers at the Centers for Disease Control and Prevention. There are unique risks to the veterinary team. Ask yourself if you have ever witnessed or done any of the following. In many veterinary clinics, veterinary staff will sit on the floor to administer treatment for large breed animals. Very few hospitals have hydraulic lift tables. Veterinary technicians will often remove their protective gloves to shave a patient for their treatment or insert a catheter, which puts them at risk for hazardous drug exposure. Some drugs handled in veterinary oncology are not on the current NIOSH hazardous drug list, so the risks may not be fully known. Here's a question for you. If you have an action that solves a problem, do you still have a problem? Decreased exposure means decreased risk. You know there are hazardous drugs in your hospital. You know how to find out what risk each drug presents by looking at the safety data sheets. You know how you could be exposed, you know the risk is real, and risk is exposure related. So what are your action steps to reduce unintended exposure? You are safe when you are educated and protected from start to finish. Education and handling is key, from delivery to storage, preparation, administration, cleanup, and disposal. Post signs, post protocols, have standard operating procedures, have safety data sheets available, and use the best practices. Use your personal protective equipment. Make this your new normal. Decrease your risk of both acute and chronic health effects. Workers can be protected from exposure to hazardous drugs through engineering and administrative controls and proper protective equipment. You are on your way to decreasing your risk of exposure to hazardous drugs. Join us for our next session, which is managing risks with personal protection equipment.